excitingly excited.
I think it helps too, like where we're planning to give birth is at the Natural Beginnings Birth Center in Statesville, and they're really good. And so when you go there, it's just like, if you have any doubts, any questions, they know it. They don't hesitate. They're not like, yeah, that's right. They're like, oh, no, da-da-da-da-da. Here's the reason, here's the reasoning. This is why we do this. They're never like, they're not giving you a reason that's just protocol. And if it is something that's just protocol, they say, no, we have to do it that way. It's not the best thing to do, but it's just like, because of insurance and the rules, that's why we have to do it. But, it's still not a big deal, and here's maybe some ways around it. So that's nice to know that, we're at a place where we trust them, and we know that they have our best interests and goals at heart. So they're thinking about it.
And they believe that, like, birth is a natural experience, like, normal and natural. It's not actually, in most cases, with uncomplicated pregnancies, you don't need to intervene and do crazy stuff, and you just trust the woman's body, and it's going to do what it's going to do. So it's not like, oh, let me, like, assess and think, like, what are the 20 problems that are going to happen? They'll just deal with them when they come. And they will deal with them. They'll be like, okay, this is an emergency. They're not going to, like, let it slide. But they're just not going to try to intervene and try to get in the way. And, and I mentioned, too, I think a couple weeks ago about, like, telling the midwives my personality type and like, letting them know, like, what I might be like during labor. And they were like, oh, we can do tough love. It's not like, if someone's like, oh, I changed my mind, I want to go to the hospital and get meds. If someone like me, were to do that, they wouldn't be like, okay, sure, we'll transfer you. They'd be like, suck it up and do it, which is what I want. That's why I picked that place, and which is, he would be good at doing that too. Even though I would get mad at him if he did that, I wouldn't get mad at them.
And we've been talking a lot more lately about, like, labor strategies and how we think it's going to work, or how our mental states are going to be, and thinking like, oh, that might be a good way, or if you go this way, this would be a good thing to mention, and stuff like that. So that's been fun, kind of thinking those out loud. I mean, you never know until it happens.
Yeah.
You always have plans before it goes in, and then, that's part of that's why you're so nervous for a baseball game. You don't know the way it's going to go. Who knows what could happen? Fastball, curveball, you don't know. You got to be ready for it.
Yeah.
But yeah, I think another thing that we want to talk about was kind of related to feeling comfortable and not nervous, is at the farmer's market last week, a lot of people were coming up to you, and particularly women, and they were saying, like, oh no, what do you do? Oh, I hope it comes, and a lot of
like, I hope it's soon for your sake, and I bet you're ready to be done.
Yeah,
like,
the energy
negative.
was kind of, it was kind of like, I don't know, it was almost, I would think if I was going through something that is potentially uncomfortable and is a big ordeal, and is something,
like
to
labor.
have that, or just pregnancy,
but also labor too.
To have that influx of,
kind of, negative.
coming onto you is kind of makes it harder to deal with it, at least for my personality. And so I could see that being daunting towards the end of pregnancy for someone who's pregnant, who's maybe not giving birth at a place where they have complete confidence in, to be like, oh, I don't know. It just kind of sets it up funny. I just noticed that was something that was kind of interesting to think about.
When you noticed, too, that it was women that were saying that to me, particularly mothers. It wasn't men and it wasn't young women. Like, it's a weird, like, sort of negative way of viewing, which I think is true. I noticed it. It was like a lot of people said that. Some people didn't. Or some people would say, oh, are you ready to be done? Or how's it going? They would ask, it's different when they ask, but a lot of people would be like, oh, I bet you can't wait because it's so hot, things like that. And I'm like, well, no, actually, it shocked them when I would say, like, no, actually, and I kind of mentioned this last week, I'm ready, I'm ready if it happens, but I'd prefer, like, wait a little while, I prefer. And everyone's like, what? Like, I don't know. I think also, too, a lot of people, they're in the mindset of a due date literally being when the kids should be due by, or like yogurt in the fridge, oh God, it's going to, like, spoil and go bad. Like, it's a terrible phrasing of what a due, like, the due date.
That definitely.
That's a big part of it.
I think that helped also, at least for me, hearing her talk about doula clients, like, oh, this is her, she's due this day, but it could be 2 weeks before and 2 weeks after, and so when we would look at that to try to plan our schedules, if she had a client that was due on a certain day, we knew that, okay, 50% chance it's going to be before, 50% chance it'll be after, and most of them are going to come within a week early and a week late. And so we knew those are the days. That's when it's likely to come. It's like a due date. There's only like a 4% chance you're going to be born on the due date.
Yeah.
So it's kind of a weird medical terminology that probably doesn't help people cope with being pregnant that late in pregnancy because you're like, oh, it's my due date, and then you get past your due date and you're like, what the hell? This is my due date. What's going on? Like, something's wrong, and nothing's wrong. It's just the way it should be. You know, they need to change that to due week or due something.
Some people do
something
due
different.
months, but I think it should just be they give you the range, like
Range.
38 to 42 weeks. You were thinking 39 to 41 weeks, but I would think there's just like a whole month range, because some people say due month. But like, that makes me think more of a calendar month, like July or August, which is hard to straddle that.
That's what I would tell people is, oh, when do you do? Late July.
And that's what we were doing for a while.
Middle, end of July.
Yeah.
And then that helps because that's how I thought of it too. Like, I didn't think of a specific date, you know, in my head. And so, like, when today came, it was like, thought of it yesterday, but then today didn't think about it, and we were like, oh yeah, that's right. You know,
yeah, because yesterday we were like, what's the date today? I was like writing something, I was like, what's the date? And I was like, oh, theoretically I should know the date of today because tomorrow is the big due date, even though, like, I forgot. Like, okay, you know, that kind of thing, because it's just the way you think about it. I don't know. I mean, I definitely, over the past few days, haven't had, or like, you know, a couple days ago, I guess, wasn't like, oh, this kid is imminently appearing, you know. And I still don't think that's the case. But I don't know now, because statistically, every day you don't have the baby, it's likelier that you will the next day. I don't know, like, because I don't know what my labor will be like. Maybe it will be like, pow, here we go, or maybe I will kind of be able to tell with some warnings of, you know, more, you know, intense, like Braxton Hicks or something, but and I can tell it's moving forward, but it seems very gradual. So, like, if it was at this pace, it seems like it would be in a week or a week and a half, which it would be fine. But at this point, I am ready, but I'm not impatient.
Yeah,
Are you impatient?
No.
Yeah.
And I don't think you'll get impatient until we get past 41. And then we're getting kind of into that 42-ish time, 41 and a half, 42, where, you know, you're like, okay, now you're getting to a point where at the birth center, it's, you know, considered a little riskier, and so you might not be allowed to give birth.
So that's kind of what we wanted to talk about this week, and I'm glad I got Jason to come on with me, or he got me to invite him. So perhaps there will be a 41 weeks pregnant update. Perhaps there will be just a couple of videos of me trying to narrate a little bit about labor, because I would like to do that. We'll see if it's possible. Maybe it'll just skip to, like, my birth story, because I don't know how possible it will be. Or it'll be like a wiggly video of him videoing me or something, I don't know. But as always, thanks so much for watching, and hope you enjoyed this video with the two of us. And I'll see you next time, whether it's 41 weeks or after the baby's here. All right, thanks. Bye.